Hello, healthcare consumers, and welcome to Gary and Jay's Healthcare Insider, the program that helps to make healthcare easier to understand and navigate. We are committed to making healthcare personal. Today's program: what is our patient safety guide and how to use it? We've developed a patient safety guide, and what we would like to do is spend some time going through this with you so that you've got a better understanding how to use it. I'm Gary.
I'm Jay.
And we will be hosting today's program. We are not clinical people. We are experienced in the business of healthcare with over 50 years of combined experience. We bring an insider's view of how healthcare works. Our goal is to share our knowledge with consumers. My career spans managing hospital and physician revenue cycle operations that include patient admissions, pre-certification, insurance verification, billing, and medical collections.
As a chief financial officer for several large healthcare systems, I came to understand medicine is both a profession and a business. Like any business, costs, convenience, and customer satisfaction are all very important. The healthcare business environment continues to change. Unfortunately, there are many varying vested interests in the healthcare system trying to protect the status quo that sometimes puts the patient or customer at risk. Our program is intended to help patients navigate these risks. Here we go with today's program. What is our patient safety guide and how to use it? Just to recap the previous episodes, there are many definitions for patient safety as organizations focused on improving patient safety. For our purposes today, we'll use the World Health Organization's definition. Patient safety is the absence of preventable harm to a patient and reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. The typical healthcare consumer at some point in time will have a negative experience with or navigating the healthcare process. Healthcare experiences include but are not limited to financial and patient safety. The consumer lacks a basic understanding of the healthcare system. This is a deadly combination that creates consumer frustration and at times medical, financial, and patient safety risks. Healthcare Consumer Navigator Center is your healthcare partner helping consumers navigate the healthcare maze. Patient safety is clearly a risk that most consumers rarely think about. This guide is designed to educate and help consumers understand patient safety. The World Health Organization estimates that somewhere around 134 million adverse events occur each year due to unsafe care in hospitals, resulting in some 2.6 million deaths. Additionally, some 40% of patients experience harm in ambulatory and primary care settings, with an estimated 80% of these harms being preventable, according to the WHO. Some studies suggest as many as 250 to 400,000 deaths occur in the United States each year as a result of errors or preventable harm. Not every case of harm results in death, yet they can cause long-term impact on the patient's physical health, emotional health, financial well-being, or family relationships. Preventing harm in healthcare settings is a public health concern. Everyone interacts with the healthcare system at some point in life, and everyone has a role to play in advancing safe healthcare. IHI works with partners around the world to improve the safety of healthcare for patients, caregivers, and the healthcare workforce.
What we'd like to do now is we'd like to dive into our guide and to give you a view of what's in the guide and basically how to use the guide. The guide to navigate patient safety is designed to help the healthcare consumer to, number one, understand patient safety. Number two, what a healthcare consumer's rights and responsibilities are. Number three, how to navigate the patient safety maze. And number four, provide checklists and tips for the healthcare consumer to follow. The guide table of contents goes like this. your patient bill of rights and responsibilities, how to find patient safety providers, establishing your personal medical record, what is medical malpractice, and lastly, checklists and tips for managing patient safety. The following is a brief summary of what information is included in the guide. Your patient bill of rights and responsibilities. Patient bill of rights is a document that provides patients with information on how they reasonably expect to be treated during the course of medical care. It is intended to provide goals and expectations for patient care. Number 2, how to find patient safety provider ratings. Safety ratings can help the consumer determine whether their healthcare provider is giving quality care. This is pretty important. So we would highly suggest that the consumers spend some time understanding how to navigate and find their provider's scores. Number 3, establishing your personal health record. A health record, also known as a medical record, is a written account of a person's health history, including appointment notes, prescriptions, treatments, tests, and vaccines. It's also for people who need the record for someone they represent or care for, like a child, elderly person, or an adult with a disability. What I can tell you is that getting this put together helps you if you are changing from one provider to another, and it allows the new provider to understand quickly where you are within the medical care treatment process. Number 4, medical malpractice. Knowing about medical malpractice damages may help you decide if you want to legally pursue damages if you believe you were harmed. This is pretty important because there are some significant limitations, state significant limitations about rewards. So it's something you should be very much aware of before you start making a decision. Number 5, checklists and tips for managing patient safety. What we're providing you here is a list of information that you can take advantage of that allows you to have a checklist of patient safety needs, tips for making shared decisions about your health care, tips for getting reliable information about your illness, tips for discussing difficult topics, tips for consumers for taking medication, and lastly, there's a great website called Patient Safety Action Network that has some unbelievably good information about how consumers can become more informed about their patient safety. So, to sum it all up, what are the takeaways for today? The guide is an all-inclusive document about patient safety. Number 2, review the guide to understand what is included in the guide. Number 3, use all or part of the guide as needed. And lastly, we suggest that you review the guide prior to any medical care you are going to receive. Healthcare Consumer Navigator Center is your healthcare partner that offers healthcare consumers information to navigate the healthcare maze via our website. The program and takeaway information of the program will be available on our website, www.healthcareconsumernavigatorcenter.com. Also on our website will be the guide that we put together, and it will be available for you by you going to our website. This concludes our program, our first our first patient safety program, and we hope the program explained patient safety and has answered some of your questions. Thanks. Talk to you soon.